Hey everyone, I'm Dan Weberg. I'm one of the authors with JBL. We write two books, Leadership in Nursing Practice, as well as Leadership for Evidence-Based Innovation in Health Professions, both actually coming out with their fourth editions now. And I'm also an ER and trauma nurse, PhD in innovation, and currently work at Kaiser Permanente as the Executive Director for Nursing Workforce Development and Innovation at the national level. I think, technology in general is really absent from our healthcare education and specifically nursing education. We're really good in the clinical space, helping students make decisions based off physical exam. And I'm not saying physical exam needs to go away. It's a core of our profession, but it's only one modality that our nurses are actually practicing in once they graduate and enter into our facilities. And so, we can simply, as a faculty member, actually augment our clinical physical exam skills with technology and AI to teach our students to incorporate different modalities to assess a patient, as well as different decision support tools to make decisions based on that assessment. So I'll give you an example. We're really good at teaching the cardiac exam. We put a stethoscope and teach them where to place it, where to listen, how to hear the different sounds, hear the different valves in the heart, and all that kind of stuff. And then we stop. And there's so many other things that nurses are going to do when they enter practice that they're going to need to learn. So imagine taking that physical exam, you do it on your friend or on the mannequin or on a patient, and then you immediately go in another room and now you do it via a video visit. And you have to do the same cardiac exam or as much as possible using a video visit. And you can see what's different. What can you not get through video? What questions do you have to ask to elicit that same information or similar information than you would in a physical exam? Then they do the video visit. So then they go to the next room and they do it via email. They have to do a secure message. Hey, imagine your patient wrote in saying they're having chest pain or whatever the symptom is. They're short of breath. What questions would you ask through a secure message to understand and assess if they're needing an intervention right away, they need to come in, or maybe you can elicit information to make a decision through that. So that's email. Then you go over and you do it via text message. Then you do it via TikTok. Now they've had the entire ecosystem of where you would practice and gather information when interacting with patients in a real hospital healthcare setting. So I think, as faculty, we have to start augmenting our assessment, our clinical decision courses with that type of addition so that our students get exposed to the different ways that we can gather information, the different modalities, and the differences in what you can and can't get through those things. Now, with AI and some of the decision support pieces, now that we have that information, have them go into ChatGPT and say, hey, I have this assessment finding. What should I be looking for? And it will help them sort of think through clinical decision making. Maybe they do that after they write their care plan and they assess it using a medical AI system to assess what's the difference. And there's tools out there that do that. There's some vendors that have these tools now. We use them with our new grads. They can really help us assess competence in real time through individual learning plans rather than what we do now is sort of like, hey, you checked the box, we checked you off, you're safe now. I think we have a real opportunity to incorporate all these pieces together. I think there's a lot of hype around AI right now. If you look anywhere on every other article, AI does this, AI replace nurses, AI is going to change medical, blah, blah, blah. The Google keynote recently was all about retinal scans and AI, uncovering your entire medical history through your eye. And I think that overwhelms people. But as faculty, we have an obligation to be trying these things out and seeing and exposing our students to those type of tools. And so I teach several classes where we use ChatGPT as a tool. And I think the most important frame for faculty is it's another source of evidence. It is not the answer. We should not be teaching our students to blindly follow the AI recommendation. We have to teach them to assess it. And so, for example, in one of my courses, I have our students create a recommendation based on a scenario that they have, and they have to write in what their plan of care is going to be and what their interventions are. And then I say, now take that same assessment data, throw it into ChatGPT. What does it say? Or find a part in that care plan where you're not quite sure and ask ChatGPT or whatever AI system it is. Ask the AI system to give you an answer. Now assess that answer. Does it seem rational? Is there evidence to support this? Based on your experience, does this seem like something that seems reasonable to consider? Not blindly follow it, but assess it using the same tools that we do with evidence-based practice. The evidence pyramid that we've had forever, the randomized control trials at the top and public opinion at the very bottom as a source of evidence, those are all in the past. Those are all 5, 10-year-old studies that we're looking at to get an answer for today. So that's a great thing to jump off of. But now with AI, we can actually ask real-time questions about what's happening in the moment. So now we can augment evidence-based practice from the past with what we know right now in the moment. That's a superpower. You can have students use these tools for free. And so you can create scenarios, and even yourself, as you're creating the scenario, go type in the answers into ChatGPT, see what comes up. And now you can compare and have that dialogue with your students. I think the other piece is you can simulate this without even using the AI tool. Let's say your school's like completely against it and doesn't allow you access to ChatGPT or whatever the thing is. You can pretend that you're that clinical decision support tool in the scenario. And so you can have the students do their assessment, and then you can mock up just by serving up that information to them, either through the voice of God in the simulation, or, with an email or some written thing, however you're doing the simulation, and serve up that clinical decision support. Sometimes make it inaccurate so that the students have to actually critically think, is this a piece of information that I'm going to use or not? Or make it really accurate, and it actually changes the way they think about the solution, and then debrief on that. And you can talk about, how did you consider this was good or bad? What experience, what evidence do you have? Those type of things. Does it seem reasonable? And you can actually use that evidence-based practice process to assess real-time suggestions from a simulated machine insight. And I think even just that gets students to stop thinking about AI as the answer and more about another data point to make a decision on.